what should be a typical scenario of just a classic good patient in chiropractic. And I'm going to use the model, the science of the three phases of healing. So what would be a classic model? And this is, we're not dealing with lack of conviction issues. We're not dealing with lack of confrontation issues. We're not dealing with doctors being afraid to talk about money or time, because those are the two confrontational topics, money and time. That's what the doctors don't want to deal with. Okay, so having said that, what would be a classic scenario that should happen with every chiropractor across the board, every doctor? Well, the patient should get treated for in other words, there should be standardization of the examinations, et cetera. And there's not. There's not in the chiropractic profession. So, probably the vital signs are the only standardization in chiropractic, to be honest with you. So when we look at patient, what should it be? Okay. So first of all, the patient should be treated for the inflammatory phase. Every patient that comes in has it. Every patient is in the inflammatory phase to some degree, or they would not be in. And patients don't come in when they don't have signs or symptoms. That's not what motivates them to come in. They have problems. They have inflammation, they have pain, etc. And the three most common symptoms are pain, muscle spasms, and restricted motion. Those are the three most common symptoms. Okay, and then of course the gateways, it's back pain, neck pain, and headaches. That's 84% of the reason patients come in. Neuromusculoskeletal extremities is 7%. That's 94%, 91% of all the reasons. That's it right there. Back pain, neck pain, headaches, pain, muscle spasms. That's 91% of why everybody coming in to see a chiropractor. Okay, that's what the market is saying. So anyway, having said that, when you plug that into the science of the three phases of healing, that model. So I'm going to say, and by the way, that is the only universal model. All these other models chiropractors use, subluxation, nobody else uses those. No, there's no other profession that uses any of those models. The only uniformed, agreed, science-based model is the science of the three phases of healing. And that's ubiquitous with every healthcare profession and every model, period. Because that's how we heal. There is no dispute on that. That's the physiology of how we heal, period. It doesn't have to do with a philosophy, nothing, okay? So having said that, patients should basically come in and get treated for their inflammatory phase, do the bowel markers. What are the bowel markers? The tests, whether it's pain, tenderness, inflammation, okay. That should be the therapeutic protocol. And then it'd be nice if they stay through the repair phase, because that's what's happening with every patient, no matter what, if it's 1 cell or 1,000 cells. The only question is it above threshold or below threshold to the patient? Meaning below threshold, meaning it's not affecting any of their senses, motor, sensory, sight, smell, nothing like that. That's called below threshold, but it's still happening. The three phases of healing are still happening below threshold. The repair phase is still happening, even if it's 1 cell that's been damaged and it's below threshold. That mechanism of physiology is still happening. And then, of course, when there's a lot of cells involved, now it gets to be above threshold. And then there's different sensitivity tests. Some tests are way more sensitive and pick something up faster. Some don't pick it up, or so you need to do a completely different test to find something. That's like to find a dynamic problem, you got to do a dynamic test. You can't do a static test to find a dynamic problem. That's kind of so when the average patient should stick to the repair phase, and then same with remodel. We know that tissue that's coming back in, however many it is, even if it's sub-threshold, we know that tissue, that type 3 collagen, which is the new collagen, type 1 is what we're born with. It's not as elastic, it's not as strong, which means if the patient heals that way, they end up with a permanent problem to some degree. Now, the question is, how much above the threshold do they heal permanently? That's the question. but they still heal and it will be permanent. And of course, the goal of the physician is that when it does heal, it's below threshold. That's the goal of it, but it's going to heal abnormally. Abnormal tissue will not get back to 100% normal, period. That will never happen. It's the degree, it's the quantity and quality that will determine, and is it above threshold or below? And of course, the goal is to have it below threshold, so it doesn't impact the patient and with their activities of daily living and things like that. Okay, that's what the therapies. And so we look at the therapies. What therapies are we doing in the repair phase that justify, and remember, all of these should be quantified, because every time we do a re-exam, we should be able to quantify those tests that tell us if they're getting better, worse, or staying the same. So we do the test, we know what's happening physiologically in the repair phase. We do the test, and we know there's different sensitivities of tests. Some tests are totally irrelevant. Some tests are a little relevant. We call those secondary tests. And then some tests are what are called primary tests. So are we even doing the right test? And so that happens a lot of times. Doctors don't even do the right test. I have doctors that come to me that have not even ever checked overpressure range of motion. They didn't even know what it was. They just remember hearing about it in school vaguely. And that's one of the major tests. That category of mobility is one of the highest probabilities of a permanent problem with injuries, overpressure motion. And then same with joint motion. There's a lot of chiropractors that come to me, they don't even evaluate joint motion. They don't evaluate nothing dynamically with the joint. And remember, there's 3 ranges of motion. There's joint, overpressure, active. Most chiropractors are only evaluating active range of motion. That'd be like, somebody going to a cancer doctor and, there's 3 levels of cancer and he's only testing for the lowest, weakest level. He's not even testing for the medium or the higher probability cancers. He's not even testing for it. That's what chiropractors are doing, because those are the most important tests. It's the overpressure test and especially the joint motion, because it's the joint motion. That's the fulcrum of all the problems. And that's the fulcrum when it heals wrong. That's where it all starts. It starts in joint motion, and as it deteriorates, it gets worse. It starts going into active range of motion, and it starts eating, or overpressure, and it starts eating into active range of motion at the end of active range of motion. You've seen older people that get old, and they can move 5-10 degrees. When they try to go into the furthest ranges of motion is when they can't, because it ate up, ate up, meaning it degenerated and destroyed, reversing. It doesn't start from 0 degrees out. It starts from the full range of motion and starts decreasing the motion and causing pain coming in. So the first motion that somebody will lose is joint motion. Well, you won't even know it if you don't do the test. And so often chiropractors don't. And they don't know it. They haven't studied it. They don't know basics of a motor unit. They don't, they'll learn active range of motion. You should be able to go certain degrees forward, backward, left, and right. Almost every chiropractor knows that coming out of school. They don't know overpressure typically, and they don't know joint motion at all typically. And those are the most important tests relative to a functioning human, especially spinal problems. Remember, 99% of all spinal problems are biomechanical. They're not visceral. It's not cancer, tumors, infections. It's biomechanical. It's altered spinal biomechanics, and it's not in the gross range of motion category, overpressure. It's in the joint motion category. That's where it all starts, either from major trauma or micro trauma. That's where it all starts. And then as it gets worse, or if it happens with major trauma and it all happens fast, then it could immediately impact joint motion, overpressure, and active range of motion. And we see that when patients come in. They come in a lot of times, they do have restrictions in active range of motion, especially in the plane of injury. But that's not the starting point or the stopping point, but that's the point that typically the doctors are only paying attention to. So you have the repair phase that goes on, and then the remodel phase that goes on. And it happens whether or not you're helping the patient and doing therapy or not. That's what's happening. So they are going to heal normal or abnormal. That is a fact. So when chiropractors do not apply physical medicine to affect the joint motion, overpressure motion, active range of motion, and that patient does heal. Now, if they heal above threshold, well, they know it immediately. The pain and restrictions are just there from day one with the activities of daily living. If it's below threshold, they don't know. You don't know. It still heals wrong. It's just below threshold. Now, the problem is with spinal is we don't know if it's normal or abnormal dynamically unless we take dynamic motion x-rays. Because so many times you can have all these other tests that are normal. You can even have a absolutely normal static x-ray, which is rare, by the way. Chiropractors know that. An abnormal motor unit, in other words, spinal biomechanics. Now we're talking joint motion. Abnormal spinal biomechanics joint motion. Because remember, that's the fulcrum. And it's such a bizarre, weird thing that the thing that most is important to chiropractors is the least taught in school. They'll teach you how to take the blood pressure. They'll teach you how to take the pulse. They won't go into and emphasize the most important test, which is the overpressure joint motion test, because that's where the problems start and that's where they end. And then it all deteriorates from there with the patient, depending on if they're normal or abnormal. And so my point is, if you don't have the conviction or know it, you can't explain it. You can't say it with conviction. You don't know it. And a lot of doctors, when they don't know it, they don't do it. So they don't even do the patient education. Well, you got a big, big problem as soon as you don't do the 4-day patient education. And I cover that separately. There's 10 major problems that go wrong that you totally violate the natural purchase pattern consciously and subconsciously of a human being when you don't follow those 4 categories, because all 4 of those categories were all based on 10 major concepts of how I like to buy products and services and how I like to have information coming to me in a certain order. So soon as that lack of conviction occurs, if the doctor doesn't do it or he bastardizes it, he takes pieces of it and he tries to shove it in day 1 or day 2 and do it day or whatever, it's over. It's over. It's not going to work because the major concepts have been violated. And why did it all start? Well, it really all started because the doctor didn't have the conviction of understanding that they did not even do the tests that were most important to the patient. They didn't quantify them, evaluate them. And I was talking to a doctor the other day. I said, and he'd been doing patient education for about 6 months. I said, he couldn't explain simple biomechanics of a flexion extension x-ray or left and right lateral bending. He couldn't even explain it. I said, well, immediately when I know you can't explain something, you're definitely not going to be educating your patients on it. And if you're not educating your patients on it, you're not doing the tests that are the last test to heal. I know those patients are leaving without getting that care. They're not getting the repair care or the remodel phase of care to decrease the likelihood of those permanent injuries. That's what I know. That's what's happening to the patient. And it all starts from the doctor's lack of conviction. And the lack of conviction comes from his lack of studying or being aware of how this works. And I know that's hard to see if you're a chiropractic assistant listening to this. It's probably blowing your mind, and it should. And I say it all the time. They should not even hand out degrees without the chiropractor having a deep, thorough understanding of the 3 phases of healing. And they don't. And high and low sensitivity tests that determine each of the phases of healing, whether the person's getting better, worse, staying the same, or ending up with a permanent problem to some degree. And they don't. And that's a major problem with patient education, is doctors don't have the conviction. That's where it all starts. And lack of conviction starts with lack of knowledge. That's why when you see doctors who are educated in it, they get stronger and stronger in their beliefs because they understand how it works. And when they understand not only how it works, but the negative ramifications for the patient. Because remember, every time the patient does not go through physical medicine in at least the repair or the remodel phase of healing, they are ending up with permanent collagen and neural issues to some degree. The question is it above threshold or below threshold? But that doctor is allowing permanent problems to be set up with that patient, period. That's a physiological fact. Even if the person already had permanent problems, they're just allowing another layer, and I kind of call it like an onion, just like laying another layer of permanency with the scar tissue and the neurology. And of course, that's what affects the spinal biomechanics. It's not just ligamentous lesions, it's the connective tissue, loss of elasticity, or this is what alters spinal biomechanics. And of course, altered spinal biomechanics is the absolute precursor to, it goes right down the steps to abnormal movement. Abnormal movement sends all kinds of alarms off in the body, pain, muscle spasms, degeneration, wear and tear, which eventually leads up to osteoarthritis, the number one disability in the United States. 1 in 5 people have debilitating disability of osteoarthritis. 1 in 5. And that's people who have already are at the end stages. Well, there's still a massive amount of people that are headed where the end stage is. They're headed in that direction. They're in the spinal degeneration phase 1, 2, or 3. Okay, that's the problem. It's all and that's why a lot of times when doctors and the in the profession, the best source of research material that creates the conviction. I mean, I can explain it. I don't cite resources and peer-reviewed journals and all that. I explain it from like just a blue collar layman's standpoint, but that's chiropractic biophysics. They did all the research. They have all the tools. They've got all the peer-reviewed journals, and their whole technique is based on the science of the 3 phases of healing, and they put a lot of emphasis in the rehabilitation and the structural movement. Because what happens is if the patient ends with abnormal motor unit at the end of that remodel phase, even though all the other tests are normal, we know that's leading to permanency. We know all of this is coming back. We know that abnormal motion is going to start creeping in, it's going to start causing pain, muscle spasms, restriction, degenerative changes, wear and tear, osteoarthritis. And so it starts eating into the person's activities of daily living, working, sleeping, bathing, showering, dressing. And then we know as chiropractors, it starts eating into their behavior, their attitude, their outlook on life, how they treat their spouse. And how did it all start? It all started with minor trauma, macro trauma, that they did not heal as optimally as they could with physical medicine and all 3 phases of healing. That's how it all started. And so now here come all the drugs. And though that's why all the drugs, that's the number one selling drugs, NSAIDs for osteoarthritis. That's why. Okay, so that's chiropractic's huge potential role. Are we anywhere helping to any dent in that? No, not at all. Only 8% of the population seeking chiropractic care. And of those people, I don't know of a statistic, but here's what I do know. I will guarantee 8% of those patients are not being educated to go through the science of the 3 phases of healing. I will guarantee that. What does that mean? Whatever 8% that aren't, they are definitely creating permanent problems to some degree. The question is whether it's subthreshold or above threshold. That's what's going on. So one of the things that I suggest to chiropractors is that the best thing you could do for patient retention is first learn it. First learn how the body heals. And I would actually take the first course of chiropractic biophysics. Now, you do not have to get certified. They have a certification. I don't know how many weeks. It might be 4 weekends or something like that. Because it's not only understanding the research and the physiology, to a great, great degree. It's the therapeutics. What do you do and how do you do it? So, I don't necessarily think but I tell you what I do notice. Doctors that come to me who have been to chiropractic spinal biophysics have no problems implementing implementing the science of the 3 phases of healing with the patient education and the 4 days of patient education. They have no problem with it at all, generally speaking. Because they know it. It's a conviction. They know how it works. Not just how it works, but they know that if they don't do it, they're helping to lead to permanent problems because of their lack of conviction or confrontation. That's what's happening to these patients. Just like if a family member went, there were 3 tests for the cancer, the doctor only does 1, it's the weakest test. This is what the majority of chiropractors are doing. They're not even doing the most specific test for cancer, the 2 other tests for that cancer. They're not even doing it. And those are motion study tests and overpressure range of motion coupled with dynamic orthopedic tests. Those are essentially the main findings of joint dysfunction. And that's what we deal with as chiropractors. We deal with motor unit joint dysfunction. That's essentially what we're treating when we treat all these conditions, back pain, neck pain, and all this stuff.